Hi everyone, welcome back to our channel. I'm Kelsey and I'm here to continue these series on pain. Today we're going to discuss acute pain versus chronic pain and why this is important in our series on chronic pain, what to do with it, how to manage it, etc. The reason I'm talking about this is because I am a physical therapist and this is what I specialize in. So, starting, acute pain, what is it? In the most basic terms, pain that arrives as a result of some form of injury, right? The normal healing cascade, the timeline that our bodies have that happen all the time, occurs, pain arrives, and then it leaves. Our body has done its job. Chronic pain, on the other hand, the same thing happens. Maybe it's an injury, a surgery, whatever. Pain arrives, the normal healing cascade occurs, but for whatever reason, the pain does not leave this time, it stays. So we consider pain chronic at about that 3-month mark typically, when that healing phase would occur, but for whatever reason that pain isn't going anywhere. So acute pain again can be caused by a variety of factors, right? Trauma, injury, surgery, any form of medical procedure, and the intensity varies. But that subsides when it's treated or healed. So why would pain become chronic? We're actually going to discuss this in a following video because it warrants more attention, because we actually don't really know yet. There is a lot of speculation out there and it's very nuanced. As far as we know right now, there are many things that continue to elevate our body's innate alarm system that tell us, hey, danger, something's happening, there's a threat here, even when it's not. If you don't understand this, please go back, watch our previous video where we discussed what pain is. That will help you understand this concept, and it is crucial as we continue this discussion. So let me go over the normal healing timeline very briefly. There are 3 phases. First, the inflammatory phase. Second, the proliferative or regenerative phase. And third, the remodeling phase. Our bodies go through this all the time. Think about when you get a cut, what happens, blood flow, scabs up, there's maybe a scar, depending on how deep it was, it heals, right? This is that process that's happening over and over again. The inflammatory phase is the shortest and it happens immediately, usually within the first few days of an injury. Characterized by what you would think of, swelling, pain, redness, etc. The body's sending blood flow, chemicals, specialized cells to help heal whatever has happened. The next phase over the next few weeks is called the proliferative phase, which begins right a few days after the injury and lasts for up to a few weeks. So the body starts to rebuild whatever was damaged and forms new blood vessels, new connections, etc. If you have a wound, it might start to close in this phase. You might develop some scar tissue. The third phase, which is the remodeling phase, is when the body really starts to strengthen the healed tissue and bring it back to normal. This can last for several months to a year, depending on what the initial injury was. And at this point, you're getting ready to go. This is when we're full speed ahead, you're back to normal, things are happening. Again, these timelines are going to vary based on the severity of the injury, whether it's a broken bone or a torn ligament or a strained muscle. This is going to depend on what that timeline looks like. So when we talk about chronic pain, it is persistent and long-lasting beyond this phase, beyond these phases, I guess I should say. This could have happened, and usually it does happen, but for whatever reason our bodies are stuck in that loop of danger signal, what's going on, our nervous system is on high alert, and this continues to occur and the pain persists beyond our body's normal healing timeline. I can't say this enough. Let me give you an example. So PTSD, because PTSD, post-traumatic stress disorder, and chronic pain often work very similarly and can actually be linked, but more on that. So like a wound, PTSD can cause ongoing pain, discomfort, extra sensitivity, even after the initial injury is healed or the event has happened, right? The wound can be still tender, it can be sensitive, irritable, etc. Like individuals with PTSD can experience recurrent nightmares, hypersensitivity, flashbacks, etc., right? So even after the event has ended, the symptoms persist and can be triggered by reminders of the trauma. Maybe it's a sense of smell or a sound or a particular event that causes that sensation to replay itself in the body. Chronic pain works similar and has those same effects where your body remains on high alert, right? It hasn't gotten out of that loop where something is still causing your nervous system to become heightened. Remember, and then I said this in the last video, pain is your brain's opinion, it's not a fact. It's a sophisticated alarm system. Go back to the previous video. If this is confusing to you, this piece is really, really, really important. It tells us there's something we need to pay attention to. Pain says danger, right? It does not say that something is wrong with me. I will say that again. Pain says danger, pay attention, hello. It does not say something is wrong with me. Coming up, we are going to discuss a little bit more about why pain becomes chronic. I know in the beginning of this video, I just skipped over that really quickly. It's really crucial that we continue to have that discussion as we understand what chronic pain is and how to manage it. So continue to stay tuned. Next time we will talk about why pain becomes chronic and what to do. Thanks. Bye.